This ultrasound study pertains to a female aged 33 years old and had cesarean section 15 days back. Since then has fever with rigors. Is on antibiotics, verbal, all verbal. What we are seeing is, first of all, let's evaluate the uterus, and you see that the uterus shows dilated endometrial canal with multiple layers in it. Here we see this is the fundus of the uterus, and this is the anterior myometrium, posterior myometrium, and this area in the center is representative of endometrial canal. This is the endometrial canal, and you can see multiple tiny thread-like structures within it, giving it a layered out appearance, and the endometrial canal is dilated up to 2.3 centimeter. Normal should not exceed 1.4 at least 15 days after cesarean section. So this is the finding number one in this female. However, this is the cervix, and again this is the endometrial canal. Now we are seeing this in longitudinal section. Let's see in transverse section. Now this is the transverse section. Let's magnify a bit and see. Now you can see that there are multiple layered out echogenic material within the dilated endometrial canal with fluid. This part is the fluid, and rest these are the echogenic areas within this dilated endometrial canal, something around 23 millimeter from this angle, scanning plan. This is the endometrial canal, and this is the uterus. In transverse section. So we can see that the endometrial canal, there are multiple particles, echogenic, with fluid within it, and however, and few of them we can see are giving shadowing as well. This is a tiny particle giving shadow. Secondly, you see that there is fluid seen within the posterior to the uterus that extends up to the cervical region, posterior to the uterus, with multiple echogenic particles, tiny shining particles within it. Now see, this is the uterus. As I am giving a bit pressure, and the scanning plan has changed, therefore you will see only this much of the uterus. Well, this is area from here to here and from here to here. This is all fluid fair pocket, you see, measuring approximately 11.4 centimeter in length posterior to the uterus. This is the uterus, posterior to the uterus, and 3.7 centimeter in anterior posterior diameter. So this is with multiple echogenic particles within it. Now in transverse section, this is the transverse section of the same, and here we can see both. See the dilated endometrial canal with fluid and multiple echogenic linear and tiny areas within it. This is the uterus. This area is representative of the uterus in transverse section, and this area is representative of endometrial canal, which is dilated. This is the endometrial canal, and this is the pocket full of fluid, eco-filled fluid, posterior to the front uterus. Now you see this is the echo-filled fluid pocket, and you can see posterior wall acoustic enhancement or strong back wall behind it, behind this echo-filled pocket. Now another issue is that when I move the probe and I go towards the right lower abdominal quadrant, this fluid tracks in the same region upwards up to the, and this can be tracked up to the lower abdominal quadrant with thick mesentery. This is the major part of the thick mesentery. This is all echo-filled fluid tracking from the pelvic cavity into the right lower abdominal quadrant. Now this is the right lower abdominal quadrant. These are thick mesentery and are suggestive of adhesions within this. These are adhesions, as we can see on ultrasound. So this is in fact the cause of, now this is all echo-filled fluid pocket, which is extending from posterior to the uterus from the pelvic cavity and going up to the right lower abdominal. This is the region of the right lower abdominal quadrant. It measures approximately. Now from in this location it measures approximately. And M is in fact representative of mesentery. Okay. So echo-filled fluid with dilated, ECHO. Let me correct it. Sorry. Okay. So this is also measuring something around 13 centimeter by 5 centimeter and is echo-filled. You can see the shining movement of the particles within the fluid. You can see the area of adhesion that is in the region of right lower abdominal quadrant / right iliac fossa. Now let's see what is the status of the liver, kidney. Now kidney is showing relatively prominent pyramids, raised parenchymal echogenicity. That's on the right side. These are the pyramids. This is the central sinus echo-complex, and this is consistent with pyelonephritis or infective changes. This is the transverse section. You can see normally the echogenicity of the renal parenchyma is less as compared to that of the liver, but here you see that the echogenicity of the cortex is raised. Pyramids are significantly prominent, a feature consistent with the infective nature of the pathology. Portal vein is okay. Pancreas is okay. No fluid is seen in the paracollicator. Now there is here. Well, there is small amount of fluid now seen in the right paracollicator. Small amount of fluid with echoes is seen. This is the iliopsoas muscle. This is fluid collection in the iliopsoas muscle. Small amount of fluid pocket with equity force within it. And however, on the left side, what is the situation on the left side? You can see fluid is same with equals in the region of left paracolic gutter. The complicated case post-cesarean section, there is no evidence of pleural effusion. This is the hemidiaphragm left spleen. This is the kidney showing the same changes as we saw on the right side. So this is our case of the day. This is our case of the day. Thank you very much.